Hi, my name is Greg Felt. I'm Director of Public Health for Sheffield, and this is the situation report of today, the 8th of March. Upbeat, most indicators are moving in the right direction, moving fairly consistently in the right direction. Top line is that Sheffield rates are higher than the England average. There's no news there. We're getting back to a place where we were in September, and our rates are now well below 100 per 100,000 and continuing to fall, and that improvement is beginning to accelerate again. So after a period of flat, we're now on second wind, and rates are coming down. Rates in the elderly are coming down. Number of people in hospital is coming down really quite quickly now. So that is an impact of the vaccine. It's also an impact of the lockdown. Looking forward, if we can sustain the current trajectory up until the point in May where two households can meet indoors, then and given that the real crux of this has always been about household transmission, then we'll be in a position where rates of transmission are really low in Sheffield. So that's why sticking with the rules has been so important. Thank you for doing that. Death states are coming down. A big drop in the number of deaths, and really it's the astonishing impact of the vaccination is making that happen. Vaccination is also having an impact on the number of admissions for admissions to hospital, and where there are cases, particularly cases in the elderly, and there are still some cases are milder and less people are ill, and of those that are ill, less of them are really poorly. So all up, hospitalisation and deaths are again going down and going really quickly. So we've got 5 weeks up until the point of the next stage of the roadmap, and if progress continues, then we'll be in a really strong position. The basics will remain the basics, so we will keep the same basic strategy. We will be following up on cases, ensuring rapid and complete contact tracing, support for isolation. We'll probably be putting a bigger focus on workplaces and cases associated with workplaces over the next period, and household transmission remains really important, both within households and between households. Longer term, we'll continue to need high vaccination coverage. We'll continue to focus on getting vaccine-induced herd immunity. One of the reasons why we are really reluctant to let the virus spread unchecked in non-vaccinated populations is that still 10 to 15% of people who have the infection, be they young or be they old, will develop long COVID, and that's not something that we would wish upon anybody. So we'll continue to monitor that really carefully, but for now the situation is improving really quite rapidly at the moment. So thank you to Sheffielders for continuing to stick with the rules, because that has made a massive difference. So, short update on vaccinations. Certainly well over 200,000 people have had dose one. So more than a third of the population. We're well into cohort 5 and cohort 6. If you're in cohort 1, 2, 3, 4 and you missed your vaccination, it's not too late. So please book an appointment if you missed your first vaccination. We want to make sure that we get as many people vaccinated as possible. So just one of the things that's cropping up this week, about two out of 5 over 80s who've received the first dose of the vaccine less than 3 weeks ago report that they've met someone other than a household member or care worker. And it's important to know that you're not fully protected after your first dose. You still have to follow the rules. So basically, the first dose of the vaccine starts the process of building up protection, but the second dose is the thing that seals the deal, and you do need 2 doses, and it's really important that you get 2 doses. It's really important that you continue to follow the rules until you've had your second dose. Imagine you and a friend are trying to move something really heavy. You can get it part of the way yourself, but ultimately your friend needs to help you move it for the full distance. So the second dose is like the friend. You need both doses to complete the task. Vaccines that need more than 1 dose aren't uncommon at all. So there are plenty that are in common use. So the measles, mumps and rubella vaccine needs 2 doses. vaccinations against hepatitis A, hepatitis B. Many people have had needs 2 doses. The shingles vaccine needs 2 doses. So it's really important that one, thank you for being vaccinated. It is making a difference. 2, you're fully protected after your second dose, and it's important that you follow the rules up until that point. And you will be invited for the second dose, and that's beginning now, and many people have had the second dose already, but please do continue to follow the rules. Household and workplace transmission. So cases are continuing to fall across the city, and thank you to everyone for doing the right thing. It's made a massive difference. We know the majority of people are following the guidance, and that's helping us get back to where we want to be and to reopen the economy. As lockdown eases, it will be tempting to drop our guard, to relax our behaviours and to forget about the virus. The pandemic isn't over. We're in a game of football, COVID FC versus Sheffield FC. We'd be equalising 3-3 with 15 minutes to the final whistle, but the game is not over, and we need that final push to get us to full time and to score the winning goal. The data in Sheffield is really clear. 70% of all new cases are caught inside our own homes from people we live with, or from households we are mixing with. Hence the importance of within and between household spread. The new variant, the Kent variant, is 50% more contagious, so spreading is even easier. A few things are happening here. When we leave our homes, firstly think, do we need to? But most of us are taking the precautions to stay safe, but when we arrive back from home, either from work or from a shopping trip, we can naturally drop our guard. Wash your hands when you get home, immediately you get home. It could be very tempting to have a doorstep chat with friend or neighbour, but it only takes a second to spread the virus from someone who you've been in contact with. Yeah, I know it's a hard ask. Every little thing we do helps us keep those numbers dropping. So what we're asking you to do is not invite COVID into your home and not to be the person that brought COVID home. So think twice about that catch up. Think twice about when, where and how you wash your hands when you come in from outside home. We're on the final stretch here now. Be careful to wash your hands, be careful to clean high touch surfaces, and keep in communal areas and keep each other safe. If essential maintenance workers are coming into your home, take those precautions and wear a face covering and clean up carefully. Workplace transmissions are similarly high. So again, just take care, wash hands and clean down surfaces regularly, and that keeps it going in the right direction. So a quick update on where we are. Schools are back now. Thank you to parents who've home educated for the last month or two, and thank you to the schools who have been open throughout. But schools are now fully back from this week. As we welcome children back into schools, twice weekly rapid testing is available for parents and bubbles of primary school and college age children. That will help us find more cases and break more chains of transmission. So I'd encourage everyone to get involved in that. There are many ways you can access the tests, but the best route in is to look on our website, sheffield.gov.uk/back to school safely. The webpage has lots and lots of other information, including when your child should wear a face covering, what to do if your child has symptoms, testing for secondary school pupils and loads more. And we look forward to updating you in future weeks.